Now, after a difficult period of COVID-19 spread, there is worry about a lack of National Health Emergency Fund to deal with future pandemics. A non-government organization, Send Ghana, says government must establish a fund specifically dedicated to dealing with future pandemics. The NGO has also commenced a project to support MMDAs across the country to raise revenue locally to set up health emergency funds. There's more in the following report.
Ghana's economy is still reeling under the effects of COVID-19. At the height of the pandemic, government borrowed heavily to fund the fight. Advocacy group Send Ghana is calling for the establishment of a National Health Emergency Fund.
We brought together all the districts that we are implementing this project to share their experiences. I mean, like you heard here today, some districts have already put in place some structures for epidemic preparedness. Others are yet to do so. We decided to bring all these districts together to share. I mean, there's learning and sharing. When you share, then you can learn from the other person and what strategies they are doing or what strategies they are putting in place to prepare for epidemics. And as we know, epidemics are events that are unplanned. They are unpredictable. They can happen at any time. And so it's important that districts or government agencies are able to put together structures in preparedness for outbreaks as and when they happen.
Communications Officer of Send Ghana, Joanna Ankoma Ade, says a National Health Emergency Fund will cushion the country in case of an emergency health situation like the COVID-19 pandemic.
You know, in 2020 when COVID happened, we also saw how government had to quickly put together funds, you know, how even to a point that we had to borrow and then get support from our donor communities. I mean, this support might not always be there, and so it's important that countries such as Ghana put in place some funding or dedicated budget line of funding for epidemic preparedness. I mean, COVID came in 2020, then we had the monkeypox, then we have Lassa fever now, you see. So, I mean, there have been a trend over the years of disease outbreaks. Who knows what might happen next? The sole purpose or goal of this project is to get the government of Ghana to establish a public health emergency fund. So this fund will be used to fight diseases as and when they happen. You know, we don't want to wait till an outbreak happen and then we are going to borrow, then we have to call private sector to give us money, then we have to, you know, ask, you know, then this money is there. This is something that we can always take from.
Meanwhile, the District Director of Health at the Brim South District in the Eastern Region, David Mensah, says it is important corporate entities come in to support districts in deprived areas.
For emergency preparedness, nobody can be fully prepared for an emergency, for all emergencies. But you put in place measures to ensure that when they do happen, you are able to respond to them appropriately. And that is the more reason why this fund that we are to set aside is important. But if you come to a district where funding is a challenge, as the Brim South District, currently we are doing our best. We have put in place measures. We have put in place systems such that the health facilities have emergency response teams in place. But as it stands, these structures will need funding, and that is what we call on civil societies and organizations and individuals to come to the aid of the district to help us put in place such a fund to help us manage and get ourselves prepared adequately for potential outbreaks. Train them